Now program is brought to you with the support of our founding partners.
But I'd like to introduce our guest today. We'll start with Melissa Kree. Melissa is with Oxford Community School District. So Melissa, would you mind just introducing yourself and provide a little background on your connection to the topic?
Absolutely. Thanks for having me. Yeah, Melissa Kree. I'm a school psychologist in Oxford schools. So we experienced a school shooting in November 2021 where 4 high school students were killed. And I also live here and raise my kids here. So it's been, I've been obviously very connected to and passionate about building and recovery from our tragedy, but also making improving our systems, learning more about this topic, and really then sharing our learning and the work, to me, the really great work that we've been doing with other professionals. And that's what led me to your group, and just the passion about growing this work. And I'm excited to share today.
Awesome. Thanks, Melissa. We appreciate the fact that you're here with us and you bring some great experience. Rick Shaw is the founder of First Preventers and Awarity. Rick, you were on this program a couple years ago.
Yeah,
Welcome back.
it seems like a couple years ago, maybe, I don't know how much long. It was right at the beginning, I think. But anyways, thanks again for having me back. I appreciate it very much. So my background real quick is I'm very passionate about child safety, very passionate about solving problems. And so back in 1999, when Columbine happened, it really got my attention to really understand why, over time, we've learned that over 80%, in some cases even higher, of so many of these incidents that happen had pre-incident indicators, red flags, warning signs, things like that. They also had sources of the information, and they had resources both in the school and the community. They had all these things, but it just didn't get connected. And so that's really been my focus, is researching these things so we can learn lessons learned and try to apply those so that we can actually, decide or figure out what's missing and what's needed and try to deliver that. So I'm looking forward to it today. Should be a great panel.
Awesome. Thanks, Rick. Welcome back, Randy Merced from Seattle University. Randy, wouldn't mind just providing a little background on yourself and the connection to the topic?
Good West Coast morning, everyone. My name is Randy Merced. First, I want to thank Zero Now for the excellent work they're doing and the passion that they're putting into this topic. My education goes back to Rutgers University. My master's degree and doctoral work was on student success and making sure that everybody's okay. I worked as a security director at Community College in Philadelphia for a long time, I think from 2003 until about 2022, I believe. As a director of public safety there, I started a BIT team and care team, and I got to learn a lot about the ins and outs of student success and how we can get students back on track when they are having some difficulty. Then I went to Front Range Community College in Colorado. I had some success there at that BITA team as well. And now I am currently at Seattle University, which is a great institution. They have a wonderful care team, and I'm proud to be part of that association.
Awesome. I'm glad that you're here with us, Randy, and share your insights from all the past that you have. So, and like we said yesterday, it's just beginning. We're on this journey together. To get started, so like I mentioned, we've had a lot of discussions all month about mental health and what that means. But Rick, like, how would you define mental health? And I'd like to get each of your perspectives on this, because that is it's a broad topic. What exactly does that mean?
Yeah, definitely a broad topic. I mean, you can have everything from that can, mental health, it can be diagnosed, obviously, but there's also other things that can lead into it: loneliness, sadness, depression, drugs, all kinds of other things that can create these things. But I think that all comes back to, for me, is that in order to diagnose or assess anything, you have to have all the indicators. It's like if you walk into a doctor and say, my foot hurts. Okay, well, that could be a lot of different things, right? And that's kind of how I think it is that we have to start looking at mental health, is that we have to know so much more about when we observe these different behaviors, concerning behaviors, things like that, it has to get to someone who can help diagnose it and see what's going on. Because sometimes the person that is experiencing this, they don't either want you to know, they're covering up, they're doing all kinds of things. So it's very important to get not just input from the individual, but input from the people in the community and people around them who are observing some of these behaviors, so that we can help figure out, is it really a mental health disease, or is it something else, or all the above?
Yeah,
Melissa.
yeah, that's a great point. Just what I was going to add is, I think so often, there's the stigma surrounding mental health, right? And there's a lot of like, well, I don't have that. Well, we all have mental health, right? Like, it's not something you have or you don't. It's just, we all have physical health. We all have mental health. It's just surrounding, I think, human behavior, how we cope, how we handle different situations that we're all in every day. It's the reason why the same person different people could handle the exact same experience in very different ways. I think it's a lot of preventative work, at least at my level, right? In the schools, especially elementary school, just like physical health, with being aware of kind of early warning signs, early risk factors surrounding a student's social, emotional, behavioral, psychological health, and how that ties into everything at school. What we know about kids is that they're really not or adults, you're not in a good place of learning or growing if your mental health foundation isn't solid first. So kind of just acknowledging the way it all ties together.
Well, exactly, and the thing is, one of the things one of the themes that has really emerged over the last several months is that the realization that school safety and security is everyone's responsibility. It is a shared responsibility. It's not just Randy, the safety and security director, or Melissa. It is really a shared responsibility. Like you mentioned, Rick, like observing when a student might be on a potential, pathway to violence, for example, or might have some concerns within the classroom, or friends or family that see that. So Randy, how do you identify at-risk students and provide them with the necessary resources they need to get help?
Well, one of the things that's a great question. One of the things that we have to really understand is, when it comes to mental health and behavioral interventions, there are some different sides to that coin that we have to really understand. So systematically, we have to make sure we understand each part that goes towards mental health and behavioral intervention. So to build something like that in a system-wide thing, you want to start with having like a care team, or something where that would be an overarching sort of system that would help things. And within that system, you could have a behavior intervention piece. You could have in a care team, you could have a food resource program, or some way to help a student get past what issues that they may have. So having that all together and being able to use shared assessments where we can actually see what's going on, because what we don't want to do is overreact. We don't want to underreact, and we don't want to overreact in any of these things. So having a lot of those resources available really plays among each other, and there cannot be any silos within the system. They have to have shared opinions from the professionals. Sometimes we would ask a school resource officer to be part of that dynamic, but they have a limited part of it. We're trying to make sure we get these behaviors corrected, and we're not trying to discipline as a default. We're trying to make sure that we try to get people directed in a safe space.
Rick.
Just to add on to that, I think Randy made some excellent points about having a team, not underestimating, not overestimating, or overreacting, I should say, things like that. But I think the key thing there is action, because one of the things we've learned from, we've done surveys for thousands and thousands of students, and we learned that, why do you not report things? That was one of the questions we asked them. And, what we learned is that people sometimes think snitching, they sometimes think don't want to get involved, things like that. But the number one answer from students was that they'd already told someone once and nothing happened. So why would they tell anybody else again? And I think that was huge, like light bulb went off, because it's like, if we're gonna do this as a team, which we need to, and we need to gather all these behaviors. You know, the team, as good as they are, they're not going to see everything that's going on out there in the community. So they need these people to come to them, but they also have to take action, because if they don't, if they lose that trust, then we might lose those future behaviors that people see. So it's, you know, it's action is key.
Melissa.
I was just going to add on quickly just the importance of, you know, it's not necessarily just on, sometimes the professionals aren't necessarily with, the mental health professional may not be with the child every day or may not see the child every day. So also just the importance of equipping the teachers and the staff who do see the child every day and know that child on a deeper level and know what a change in behavior looks like for this kid versus this kid, or what does a head down look like for this kid versus this kid, some of those nuances. And then making sure that staff have a really clear understanding and feel supported in that understanding of how to report maybe some concerning changes in behavior so that we can intervene more efficiently.
Randy, please.
Yeah, I just want to, these are great points here, and I really appreciate that. I just want to make sure that I'm clear in what I'm saying. We need to make sure we clarify roles and distinguish between support and discipline, making sure that we understand what the differences are, clarifying, having clear team roles to make sure that those things are happening. At my institution, we have a large care team, but embedded within that team, there are people from different kinds of disciplines. And there's also a behavioral intervention specialist who is there as well. So we want to integrate all those folks, and public safety. We want to integrate all those folks and making sure that their roles are clear, and their primary goal is to be supportive as opposed to disciplinarian.
So let's go back to the very beginning, Melissa. So what are some behavioral signals or patterns that may indicate that there might be an issue, or a student might be in need of help?
Mm-hmm. I would say any type of significant change in behavior it's not always, right? Doesn't mean there's always something more going on, but I think it's always something that we need to be kind of on the lookout for and just responding to in some way. So this could be increased fatigue, it could be grades declining, it could be social conflict with peers, it could be attendance, it could be I haven't seen this kid in a week, right? This kid has had great attendance up until this point, what's going on? Hopefully they just have the flu, but maybe like a quick check-in, right? Just a supportive reach out to see what's going on there. And I think that's why like we look at some patterns ahead of time and how are we responding as a system to just those kind of like more minor, lower level indicators. And then on top of that, right, like there's the check-in, there's the reaching out, and also making sure that the child and teacher and parent, I think, is aware of what supports we can offer as a school. And not necessarily just when they're having a hard time, but we've been talking more about getting that information out proactively and preventatively at open houses, at curriculum nights, right? Like we always talk about what we're doing academically and curriculum wise, but what are we also doing just as a system in regards to mental health or supports for students who are struggling? Because a parent, I'd say there's a lot of families that might not even know what resources or that there are resources that exist within a school system. So, and how do I access those if my child is going through a hard time? I think is some of the things that we're working on as a district to be more in front of things.
Mr. Merced, please.
Excellent, Melissa. I appreciate that. You know, one of the things that I've seen in my line was the available resources for a good behavioral intervention team or care team. So it becomes difficult to say, hey, we're a small school, we're doing this and that, and we only have one person. And by the way, Dean of Students, another hat that you're wearing is you are the behavior intervention person. And all of a sudden they have a caseload that's overwhelming. So resources are key to success. But going back to what Melissa said, I think we need to be able to train people, train our teachers, our staff, to look out for those behaviors that might indicate that there's a problem or there's something out there. We're all in assessment mode when we go into school. So we need to make sure that we're training folks to look out for these types of behaviors. It could be physical cues like, you know, clenched fists, bullying, these kinds of things, or verbal cues, maybe the raised voice or something that that get your spider senses tingling. So we want to make sure that we're teaching them, and eventually the end result is you are creating a culture of preparedness for being able to doing this, because one dean in one spot cannot see all the problems that may come up. But if we did have an avenue or process in place that each teacher can go forward and put out a statement as to what just happened or what they observed, that makes it for a much better cultural climate.
Rick.
Yeah, it was a great lead in, Randy, and I didn't know you were going to say that at the end there about that. It got having everybody come in there or giving everybody a way to report. But the thing is that one of the things I've noticed over the last 25 plus years doing research is that we always, and most people have read these post-incident reports, we see all these indicators that were out there, right? And we see that they were, maybe this teacher knew this, or this counselor knew this, or this person in security knew this, and this student knew this, and this parent knew this, and everything. But the point is that they're all scattered. And I think that's one of the things that one of the problems I see is over and over again is that we continue, and I say we just in general, continue to create more and more incident reporting options. I'm not saying that's bad. All I'm saying is that, if you go to see something, say something, that might go to law enforcement. If you go to a trusted adult, that might go to a teacher. If you tell people to go to our hotline locally or a website or send an email in. My only point being is that we see that over and over again. And in order for those, like Randy was talking about, that, that dean can't see everything. And especially when all these other people are picking up on all these nuances that Melissa talked about, the early early indicators, if you will. So I just want to stress the importance of doing almost like a prevention assessment. Where does all this stuff, when it's coming in, where does it go? Because if it doesn't get to your team, they're not miracle workers. They can't see that stuff if it doesn't get to them.
Melissa.
Yeah, I was just going to tack onto that I completely agree. I think it's really important for a school district to be aware of all of the different places, electronically or non-electronically, that the information is put. And how are those places all talking to each other? And how are the people putting information in those places talking to each other? I do think we've improved in general, unfortunately, because of a lot of what's happened in our country about documenting and recording things and streamlining in that way. But I know even in my own district, there's kind of three main spots where information gets entered. So really working on where are we entering certain types of information, and then especially within our own district, but also when students change districts, how are we sharing that critical information between districts? And it's something that every district does differently, which drives me crazy a little bit, right? Because then how are we making sure that we're effectively sharing the most critical information? And everybody's worried about oversharing and protecting students' information, and that's important. That has to be part of the conversation. But we also need to make sure that we're sharing if we have some concerns, if we've completed threat assessments on a student or suicide assessments on a student, or the student has had these supports put in place. How could we make sure whatever team is receiving that child is aware of those things in a way to protect that student? I think it's also important to lean into the systems that already exist within a school district. School districts are overloaded with meetings and with data, right? And trying to figure out what to do with both of those things. So every school district, I would think, has some kind of MTSS or RTI or whatever your district calls it. Meetings are already happening. And historically, those were to look at more academic data, right? Because we wanted to catch the kid who's reading below grade level. We want to catch the kid who needs some academic support. But there's no reason that those types of meetings shouldn't also be used, and absolutely probably should be used, even more important in some ways, to these conversations, to be able to already lean into some process or some designated times or staffing times that schools already have existing to look at this information. So when we're collecting information about a child, getting better about entering it, but then when are we sitting down as a team to figure out what to do with it, right? We kind of know these pieces are happening. Maybe we've had some conversations with each other about it that we're worried about the kid. But when in the school day are we sitting down and talking about some action to take about that, what we know?
Rick.
Real quick, just to add on that too, because Melissa hit on a lot of the internal sources of information and some of those challenges, and that's very true. And I just wanted to point out real quick is that remember there's the community sources as well, because a lot of times in the research we've been seeing a trend where more and more of the, I guess, the indicators, the red flags, warning signs, behaviors, things like that, are noticed by external sources, meaning somebody notices on social media, somebody notices some, maybe something somebody did call law enforcement, maybe it was a nonprofit, maybe it was a church, maybe it was or a house of worship of, maybe it was. So keep in mind as you're looking at, again, these sources, don't look just internal, look external also, because there's been a lot of information that has come in from even parents, things like that. I mean, I know they're sort of internal, but they're still an external source for the most part.
And going back to that initial concept that school safety is everyone's a shared responsibility inside the school and outside the school, because you're right, Rick, and we've talked about this for years about the whole concept of connecting the dots. After something bad happens, whether it's harm to oneself or to others, you look back and say, oh man, I knew that was gonna happen, or this happened and that happened. And so you have all these dots, and when you go backwards and historically it's crystal clear. But the question is, and the point of our whole point with Zero Now is prevention. We want to prevent harm. We don't want to focus on response and recovery and everything else. We want to prevent harm right from the get-go. Randy.
Yeah, I just wanted to touch on Rick had touched on something that I think is important, and I want to underline it. This whole phenomenon called leakage, that where a school official might hear something that might be overlooked in the grand scheme of things. You see a lot of that in K through 12s, where someone might say something that might be funny or dark humor. It might be something that they might have wrote something in their creative writing class that might have been something that's overlooked. So this phenomenon of leakage, and I think the Secret Service had touched on that on their reporting. And there might be a link somewhere in this webinar for the Secret Service report. But this whole phenomenon of leakage, somebody might say, I want to harm myself or do something, and it goes unnoticed because there might be some silos. They're just talking. This is just how he talks. They're trying to get attention. So those kinds of things, we need to squeeze down on that gap and make sure that we are addressing those sort of leakage incidents. If you go to our risk management folks, they talk about near misses all the time in the insurance world, and to me, this leakage thing is sort of like a near miss kind of thing. So we need to make sure that we track those low level concerns. And I know in higher education they use a system called Maxi, and I don't know if anybody's aware of what Maxi does. It's an app. It's an application that a teacher might get information on something very low level, but they put that into a system. But then another teacher might have another one with the same student, and that's low level. And now you got 3 or 4 instances where we might need to pull this student in and find out what's going on in their world. Could be a behavioral issue. So what Maxian does, it sort of codes things out and puts things into perspective, so we can actually take a look at that. Because sometimes teachers get bits and pieces of information, but if we get those things all together, we can actually have a better, clearer understanding of what that student's thinking at that time.
Melissa.
Yeah, I was just going to echo that sentiment, and I think especially maybe with elementary, maybe some younger middle school, there's sometimes maybe a perception that like, oh, they didn't mean that, or that wasn't a big deal, right? But like it is if it becomes an ongoing or recurring pattern. So I think that just echoes the importance of documenting those situations, because when I can document those things at an elementary level, then my middle school colleague, when a situation comes up potentially for the first time at middle school, if there's a system that they can see the pattern throughout elementary school, right? So how are we kind of showing those patterns because I do think oftentimes we think that's just things kids say, or they're just saying that because they're upset. And sometimes it is, right? Like, it's also important not to like overreact in some ways. But it is something still just to make a quick note of, because if it becomes a pattern, and so that for the next professional to be aware of too, for trends.
Absolutely. Mr. Shaw.
Just to add on to that, I mean, great points by everyone's, but that history is huge because, we see a lot of times after the events, people talk about this pathway to violence, right? And it's like, when you go back, you look at it, you go, okay, they were bullied, and then maybe they got in some fights, and then maybe they became the bully. And then maybe they became making comments and threats, and but if those things along the way, if you didn't think that bullying at first was important, or you didn't think that fight was important, or it was a one-off or whatever, you didn't think, if you don't put those things into this central platform that follows them along the way, you forget them, or you don't realize they even existed because you have turnover and stuff like that as well on your teams. So great point by Melissa there, because it's so important to be able to look back, and Randy too, talking about how, keeping it all together. So that's so important, because we keep seeing that pathway to violence. And I prefer to call it a pathway to prevention. We got to step in there and intervene so it doesn't become a pathway to violence. That's a better way to go, in my opinion. But
No, exactly, 100%. And I definitely want to dive into some of the technology in just a moment here. So I want to remind folks, we're about halfway through. So if you have questions, please hit the Q&A button and type in your question. We have a lot of questions that came in from registrants as well. So we probably won't get through all the questions, but please submit your questions with Q&A. One of our Zero Now advisors, Guy Blissner from the state of Idaho, talks about the teacher's superpower, right? In the classroom, you certainly notice certain behaviors, changes in behaviors with students in the classroom. And so the question is, so how, Randy, I'll direct this to you. How do you train your staff and faculty and I would mostly love to get your thoughts on this as well, to identify signs of distress? And then we'll talk about the technology, reporting those things, sharing those concerns, either in the classroom or outside the classroom. But how do you train your staff to recognize behavior changes?
That's a great question. I think that's a gap in information that we need to look at closely as institutions. A lot of times we look at mental health, and we take the word as a pejorative, and we're saying, hey, we don't have to do this. But you need to make sure that you put mental health as part of the culture of what you're doing here. So whether it's through professional development meetings, making sure that teachers, instructors want to do professional development. They love professional development. They want to be masters at their craft, and that's great and everything. However, they need to understand how to do classroom management as well. So professional development, making sure that they be able to manage their classrooms, and then within that component is to try to identify behaviors that might set some red flags off for you, for the instructors. So having them trained is absolutely key to a successful care team, to a successful community of concern. So it's important that we do that, and making sure that it's not just an offside shoot of professional development, but part of the whole impact about, and make sure that they know what the outcomes are. It's important that too that we quantify a lot of these things to make sure that we're being successful, to ensure that we're being fair and even-handed, and training those teachers on what to look for as far as indicators that may need some outside help from counselors, or may need some other person to take a look at. It starts with the instructor talking to the department head, and getting guidance from those folks. And it takes a village more than anything else to make sure that they're doing the right thing.
Absolutely. Melissa, I mean, in Oxford, how do you train staff to be aware of signs? It's about being aware and sensitive and empathetic to those signals. How do you handle that in Oxford?
Yeah, so as you can imagine, this was a huge topic after our event. A lot of really the year, even two, even still sometimes after our event, there's just a significant increased anxiety with teachers of not doing the right thing or not knowing how to respond or missing something. So a lot of, I think, when we're deciding about start of the year PDs and trainings and those types of things, I think there's a lot of consideration that teachers are overburdened and to not add more to their plates. But in my experience, teachers are begging for this type of knowledge and information and knowing how to report when they have a concern about a child, because in our district, because it happened here, right? But also I think nationwide with the increase in school violence. So I think I don't think your threat assessment policy should be a secret, right? As a district, I think it's sharing of information, not all the nitty gritty, of course, but first of all, that we have one, that it exists, and what is it? And if you want more information about it, how can you get that? And I think a lot of time it's front loading just that information, and that as a district, we do have policies about threat assessment and how we're responding to threatening behavior. That in first, and then making sure teachers are just super clear on how to report that behavior. Always reiterating the importance of as soon as you become aware of a concern, not waiting till the end of the day, not waiting until the next day. That's hard, right? That's hard when they're in the middle of a school day, but it has to happen. And taking the stress off of them, and it's not your job to figure out if it's a threat or not, it's just your job to report it. Then there's a team of people hopefully receiving that information who are trained in determining if it is a threat or not. And really probably especially the year after our tragedy, there was a huge, I think there was a statistic that we were doing 300% more threat assessments than other districts, but that kind of makes sense, right? So things are being reported of behaviors that kids have always done. My own 9-year-old son plays Nerf guns, right? Plays cops and robbers at recess. All of a sudden you have teachers saying, well, should I report that? Should I report if there's a group of boys who are using sticks as swords, right? So we're getting this huge influx of reporting of behaviors that really is kind of just like typical developmental behavior, but I don't fault them for that, right? So I think it's making sure that you're prepared for that, to respond to that. We're getting kind of back now about 3 years post-event where our elementary school teachers are feeling a bit more comfortable, like little boys are always going to make swords out of Legos, right? So being able to try to determine the difference between kind of a school inappropriate behavior versus an actual threat. What's the difference there? How can we define that? But ultimately, in the end, if you think there's a threatening behavior, you report it. But the importance of circling back to that teacher, I think, is often missed, because there may be a report that's made and everybody's doing their best and doing the right thing. I don't fault that in responding to that threat, but circling back to that teacher who I promise you that evening is wondering and concerned and worried. So I think making sure that's part of your process to circle back about what the follow-up action was, what came out of the assessment. That's tricky with your own district guidelines with FERPA and sharing of information. And then being able, if that child is, for example, back in class the next day, if there are plans in place, if there's support plans in place, if there are safety plans that are made, sharing that information with the staff that needs to know it. I think that's a big part that needs to be part of this conversation. It's not just the threat assessment, but it's after the immediate safety is confirmed that we're safe. How are we re-entering a classroom after a big event? How are we re-entering school after that event? How are we supporting that child to re-enter is a critical piece of all of this, right? So it's not, if a student needs a safety plan or needs backpack checks or things along that nature, which may be part of a safety plan, who are we communicating that with? Who is doing that? Making sure you're staffed appropriately for it and following up with the teacher about it. And ultimately, if that teacher is really uncomfortable, they need a space to feel that they can share that too, without fear of judgment or repercussion. So how are we fostering that within a culture in our schools?
That goes to culture. Rick,
real quick follow-up on that, just that there's a lot of focus on
active shooters and red flags, and as far as training staff and things like that. And I just want to, when I'm speaking, sometimes it works a whole lot better if you're in person, but I'll have people look around the room and say, look at everything you see that's red, 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 red. Close your eyes and tell me everything you saw that was yellow. And the idea being, especially with mental health and things like that, is that we can't ignore the yellow flags, the orange flags, if you will, the low and moderate, that could be suicide related or it could be depression related, those kind of things, because those are suicides happen way more often than shootings, unfortunately. And so we need to focus on all the flags. That's just a quick comment.
Exactly. Yeah, Rick, I think sums up with the microphone, but we'll see you next time when you come back on here. Randy, if you wouldn't mind, I think you might have some additional comments, but just want to kind of look at the role of technology when it comes to reporting threats or concerns, aggregating those dots, if you will, the concerning behaviors. What role does technology have in this entire discussion?
Oh, yeah, technology is vital to the success of a good program or practice. I like to actually call it a philosophy. I want to make sure that it's a philosophy for the entire institution, wherever you may be, K through 12 or higher education, where care teams and behavior intervention teams are paramount to student success. But for technology, it really plays a good role in making sure that our data collection is on point, so that we don't make mistakes and we don't have biases in our data collection. So it's important that we make sure we do those things, especially when we're dealing with schools that may have a lot of underrepresented students. We want to make sure that we are fair and even-handed to everything else like that. And sometimes having the data collection helps support and validates the work that we're doing as counselors, as first responders, and folks like that. But I do want to make sure that we understand that technology is not the be-all, end-all. It's a good support mechanism. It's the human behavior that really is what needs to be taken care of, and that goes through training and things like that. So it's important that this is a human behavior discussion. So we can't rely on technology to take over, what we're doing as human beings, because we do have to make decisions on a case-by-case basis sometimes, making sure that we're doing the right thing all the time. We don't want to say, oh, okay, in general policy that the technology says that we should punish that person for what they did because there may be some extenuating circumstances that technology doesn't pick up on. And one of the things that we're looking at is AI. I do love AI. I enjoy what it does. I think it's very important, but it doesn't clear the role of AI. Does not take sarcasm, lightly. It doesn't take other incidents that out there like that. So we have to be careful on our technology to make sure that we have a right balance of human intervention and technology to help support that stuff, as opposed to taking over.
And the key thing is, and Rick, I want to jump over to you, is that and the philosophy that we've always maintained at Zero Now is technology are tools for humans, right? They're tools. They're not the be all end all. And you're absolutely right, Randy. I mean, they help humans. They're force multipliers for humans. They allow you to collect information from different sources and aggregate this information. And we're identifying patterns here, but it does not replace humans' role. It augments a human's ability to do their job more effectively, all of our jobs. Rick.
Yeah, my mic better? Okay. The thing is completely agree. The technology is a tool, no doubt about it, because I like to talk about making a cake. You have a recipe, you have the ingredients, and you have the tools, right? And it's the same thing here. The recipe is kind of like your policies and procedures. The ingredients are all those behaviors that Randy and Melissa have been talking about. But we have to have the tools to put it all together, because too many times we have, I know the word silos has been brought up multiple times, but we have, you have your student affairs system, you have your HR system, you have your security system, you have all these different systems out there. I'm not knocking them, but I'm just saying that they can become silos, unfortunately. And then you get turf wars and things like that. And then you've got the community systems and all kinds of things. And then you throw out oh, I can't tell you because of FERPA. And it's like, well, that's not true. It's how you tell them and who you tell and if it's encrypted or not, and things like that. So there's a lot of different things out there that we don't have time to go into, I know, but the point being is that use the tools to help you accomplish what you need to accomplish, but that is getting all those ingredients and all those policies and procedures, recipes all put together.
Yeah, I love that analogy there. Melissa.
Yeah, I was just going to piggyback on something Rick said with the silos, right? I think that's something probably everybody listening can relate to. So how are we breaking those down? Something that has been super effective in our district is our Director of Safety and Security, who's actually on this call, created two different things. One is a mental health subcommittee. So I think her own knowledge that as Director of Safety and Security, her background is not in mental health. So a lot of schools have mental health professionals employed, but traditionally may not have used them in this way, right? So bringing them in to some of these conversations, and then K-12, making sure you're having input from the different mental health professionals at different levels, but having these relationships and conversations between mental health and security, because they haven't historically happened, right? So how do we do that? There's maybe a lot of preconceived notions between those two groups of people and some back and forth. But I think even just some understanding of the why behind some of the reactions that they have, and making a professional working relationship there so that you do feel more comfortable hearing both sides, because there's a place for both voices at the table. There's an important place for both voices at the table. I am not a security or in the traditional sense of the word expert. So I need them to be able to speak to that piece, but I really appreciate their feedback and being able to give me a space at the table when we're talking about things like response to crisis and even drills, right? Or things that happen in the community and how we're responding to that. There's a place for both. There's also she's been working on creating a county-wide group, which I'm not quite sure how it works in different states. It's been hard here with the silos, even county-wide, between law enforcement and schools and county level and local level people. Again, a lot of people, especially in our area, because of our tragedy, trying to do response work to this type of conversation, but not working together to do that, which makes no sense because we all have the same goal in mind and we're all trying to achieve the same thing. So taking that initiative to, I think, connect in that way to finding people kind of similar to this group who all have similar interests, who all have a passion for this work, and how do you work together to lean on each other? Because what we've done before, where everybody kind of does their own thing, it's just not working.
No, absolutely, Melissa. Randy.
Melissa, I just want to thank you for that response. That was excellent because you're talking up my alley here. I think that's great. Public safety has a role in making in this whole form that we have here. And one of the things I've seen in my world of public safety is there's not a lot of concern when it comes to training the public safety officers on how to respond or how to look for indicators of behavioral issues. They are generally told they are here to observe and report. That's what they want to do, observe and report, and they just write a report and do things like that. And that's great, you know, whatever it is. But what we do at Seattle University, we train our officers on behavioral intervention, on suicide prevention. We also train them on, we use a Columbia Suicide Security rating scale because we do have a lot of those issues out there. We want to make sure that we're going to not miss something like that. So I think it's important that public safety school resource officers have it part of their basic training to be able to tease out and look at behavioral anomalies and issues like that and report them accordingly. Thank you for that, Melissa.
No, and that's great. We're getting short on time, so I do want to take some questions from the participants here. But it all goes back, and this is one of one of the greater realizations, like I mentioned over the last several months, is that the whole shared responsibility. And unlike other aspects in schools, public safety, school security, safety is cross-departmental. And it was interesting when we had, like I mentioned, we had roundtables with school safety directors, with school administrators earlier this month, and it's just a different perspective. But then, after having this discussion and discourse, you do see where they do work together. And it's been up. I've probably mentioned this for the 15th time now, but tear down silos, because specifically with school safety, this is something that really needs to be silo-free zone, because everyone has a stake with this. So let's take some questions here. So Jamie Gansman, hey Jamie, asks, with overall decreases in funding for school safety and mental health combined with critical increases in the need to address mental health, how have you or your organization, your schools, thought differently about addressing this problem? So how are you handling this when funding is going down, but the need has increased? And does anyone want to take this? Melissa, we'll start with you if you would mind.
I will say, not regrettably, I am not necessarily overseeing budgets, which I have no interest in doing. I share her concern. This is a concern of mine as well. We had some grants that we got from a state level following our tragedy that have ended, right? Because the timeline has ended. I think it's looking at the resources. I'm going to think about this. I don't know that I have a great answer to this, to be honest with you. I would say some of what we've done as a district is reallocating, looking at the work that we're doing. So people like school social workers, school psychologists, historically, right, when I first started this gig 15-ish years ago, I spent most of my day testing, most of my day doing evaluations for IEPs, which is still a big part of my job. It's maybe 20 to 30% of my job now, whereas when I started, it was close to 90. I think we're getting better at looking at some of the skill set of the people that we're hiring to do some jobs that it may be possible to free up their time in some different ways to do this work and to focus on this work. I think even within schools, we've had conversations on a state committee about school counselors and school psychologists and school social workers, again, all within the field of mental health, but we're all siloed. We don't talk to each other enough, right? So I think it's doing kind of an audit of your district and the resources that you have, looking at your funding sources, looking at grants, whether it be state or federal grant options. How are you using the people that you have or the resources that you have available to you in the most effective way that you can? And I also think it's not overloading the mental health staff or the support staff that you do have, in a way of looking at your more tier 1, lower level classroom based things that can be handled more in-house, and being kind of more specific or intentional about what is being elevated to the point of bringing in this additional team of people, which is work that happens within kind of that MTSS world that I spoke of before. Yeah, I don't have a great answer. I'm sorry. It's just a fear that I also share. Is all I can say.
That was a great answer, Melissa. What are you talking about? No, that very insightful. Appreciate that. Randy, do you have thoughts on that question?
Yeah, real quick. Funding's been a problem with K through 12 and higher education since the beginning of time. So everybody's fighting for a slice of that funding pie, and it's very difficult. What we can do as practitioners, as counselors, is to make sure we advocate for the need for these programs. And part of that is also recruiting parents, making sure that they understand what the implications are, because the parents' voice is very strong. So we want to make sure that the leadership has an understanding of the importance of funding, creating funding streams for this endeavor. It's not just a thing that we have this because we have to have it, but we should be able to show how important it is for academic success, anti-bullying measures, these kinds of things, making sure that they're so parents could say, my child is going to a school that's safe. It's a safe space. So those funding funding requests, funding needs can be advocated for by different stakeholders, and making sure that leadership understands the implication of reducing funding for that effort.
Real quick, because I know you're short on time, but I think the key is like when you need to do security, you do a security assessment, right? I think a lot of people haven't done a prevention assessment. They should do a prevention assessment, because that prevention assessment can do is help you identify, the areas of need, just like a security assessment or something like that does. But also you can utilize maybe previous things. Maybe you've had a lawsuit, maybe you've had a tragedy, maybe you've had something along those lines. And those lawsuits are getting really expensive these days. So that can also help with some of that justification.
So one of the topics that we have a couple questions about this and kind of tying it together. Reporting the role of students when it comes to identifying behaviors, and I mentioned this on prior programs. With my brother's school, they were able to identify a student that was on the pathway to violence, to prevention, Rick, and they were able to intervene and get that student help. What role? Just a couple thoughts, because most students, you mentioned before, Rick, they don't want to be a snitch. They don't want to turn their friends in. So what mechanisms are there for students to share their concerns that they've observed with their fellow students?
Yeah, one of the things we've learned through the research and then trial and error and working with clients is to say, okay, what if we turn this tip line, because people hear tip and they hear snitch a lot of times, right? What if we turn it into, and we use the butterfly effect. One small thing can save a life, save a friend. And all of a sudden now we're helping. And with our clients, when we went from a tip line to the butterfly effect, and we use a little butterfly as an icon and stuff like that, because it's a funnel, feeds it right into this central platform. It's community-wide, school-wide, whatever. But the point being is, you've got to change. It's culture. Somebody said that word earlier too. And I mean, it's culture. It's a helping culture versus a snitching culture. It's a help because you don't want something bad to happen to someone else. Whatever that bad is, drugs, suicide, self-harm, sexual abuse, whatever it is, right? So that's one of the things we've learned. And then make sure there's truly an anonymous thing. One of the things that we learned is that if you say, call this phone number and it's anonymous, or this text and it's anonymous, a lot of people don't believe that. Because when you text, your number's there, right? So make sure if you're going to offer anonymous, it's truly anonymous.
No, absolutely. And going back to that point that when I mentioned about my brother, it was a fellow student that shared the concern with the principal at the school, and they were able to get the student help. So that is absolutely critical. And we're pretty much out of time, but before we wrap things up, we just want to give each of you an opportunity to share final thoughts, words of wisdom, experience that you would like to share with the participants. Randy, if you wouldn't mind starting this, any final thoughts that you'd like to leave? Key takeaways, if you will.
So once again, I thank Zero Now for what they're doing. Very important work. One of my takeaways here is that everything doesn't happen in a silo. I think that was a theme of today. We have to make sure that the shared governance of what we try to do is transparent, and making sure that we do that. The reporting streams are transparent, and I think we can do a really good job in making sure we create a culture of inclusion and a culture of preparedness, so that we can identify these behaviors and bring them to the right conclusions.
All comes back to culture, and culture is free. One of the key insights of the course, the fossil we call it, the Foundation School Safety Leadership, is you can have the best technology, the best access control system, but if your culture allows for popping the door open with a rock or holding the door open for a stranger, it really doesn't do much. So it goes back to the DNA. It's just a way of thinking about things. It's a way that you perceive the world. Rick, final thoughts for our participants.
Yeah, thanks. First of all, thank you, Aura. Thank you, Mary. Thank you, Zero Now. It's been fantastic. Everything we can do to help prevention is I'm all for it. That's for sure. But I think the other thing too is part of that culture is everybody knows who the first responders are. Everybody knows really who's in charge of them. What I think we need to help people understand is we're all first preventers too, right? And so first preventers but who's in charge of your first preventers? Who's leading your offense? Everybody's got maybe knows who's in charge of the defense, who's in charge of the offense. And how do we get that offense and defense working together as the same team? Because we're all on the same team here trying to prevent these things. And so I think that's really one of the things you can do with that culture, and try to bring people together and get that helping attitude versus I don't want to get involved, I don't want to snitch attitude, because it is out there. But once they see action and they see that people will take action, you'd be amazed. I mean, how many more people will come forward then? And that's great, because that's what we want, is more people coming forward as first preventers.
Yeah, we got to get rid of the term tip line. I agree. And Rosemary mentioned helpline instead of tip line. And Rick, you mentioned, the butterfly effect. And I mean, yeah, the stigma associated with that word really, I think, does have a negative connotation. Melissa, final thoughts for participants before we wrap up.
I would say one of the biggest things we can do is equipping our teachers and our staff and joining them to be a part of these conversations. There's a lot of fear and anxiety of teachers and staff surrounding these topics and surrounding school safety and school shootings. Inviting them in to be a part of the conversations, and again, breaking down, I wish I had a synonym for silo, because we keep saying it, but breaking down the walls between departments or between staff members. I think also the importance that these are not, when a threat assessment occurs, even if you have a great threat assessment system in your district, which a lot of districts are still working on, thinking of not in terms of isolated events or incidents. There's a perception sometimes that they should just be expelled, right? Or we should, zero tolerance, kick them out of school. But then that student is still in our community, but with the potential pathway to be doing something at a movie theater or a mall or something in that way. So one of the conversations that we have a lot in our district is that pathway to violence versus pathway to care, and thinking of it along those lines. And then just being active. If this is an area that interests you, you don't have to have, the law enforcement training or the degrees sometimes. If this is an area that you're passionate about, finding out within your own district how you can be a part of this problem solving. It's something that every district is grappling with. So get involved.
And great point. It is. We could continue for another hour, but we have to wrap it up. But it is community safety, right? We talk about school safety, in the school, but it goes well beyond that. We touched upon that. Thank you very much, Randy, Rick, Melissa. Our next roundtable and our next month's topic is all about behavior threat assessment teams and management. So we're going to dive much deeper into that in the month of June. Our next conversation is June 17th at 2 p.m. Same place as we are here. Please, after this, if you want to jump into the Zero Now community, if you have additional questions, we'll post some of the questions we were not able to answer here in the Zero Now community. The replay of this will be available by next week. And thank you all for participating once again, and very insightful discussion. Thanks, Randy, Rick, Melissa. Take care, everyone.